Greetings from Believers Institute of Renal Disease. I'm Dr. Gio Philip John, consultant nephrologist at Believers Church Medical College Hospital, Tiruvalla. The theme for this year's World Kidney Day is Living Well with Kidney Disease. Today, I would like to discuss a very important topic, especially for our diabetic patients. Uh, the topic is sick day medications for diabetics. So the question is, do our patients know about sick day medications? So if you have diabetes and you're feeling unwell, either because of a flu or a gastroenteritis, you're having loose stools, you are having vomiting, you are having an abdominal pain, you are having a urinary tract infection or a skin infection, there are certain medications which you need to stop when you're feeling unwell, when you're feeling dehydrated. So there are two categories of drugs which we call as sick day medications. One which increases the risk of decline in renal function. The other one is which, because of its reduced clearance, will increase the risk of adverse effects. So coming to the first category, that is the drugs which increase the risk for decline in renal function. The first one is ACE inhibitors, or these are the drugs which end with pril, like enalapril, ramipril, perindopril, captopril, etc. And the second one is angiotensin receptor blockers, or the drugs which end with sartan, example losartan, telmisartan, olmesartan, etc. And the direct renin inhibitors like aliskiren, non-steroidal anti-inflammatory drugs like diclofenac, aceclofenac, ibuprofen, indomethacin, or nimesulide, and the diuretics like furosemide, hydrochlorothiazide, chlorthalidone, metaglassone, or indapamide. And the SGLT2 inhibitors are the commonly used, the term is gliflozin. That's the dapagliflozin, empagliflozin, or canagliflozin. Because of its diuretic effect, because of losing the sugars in the urine, and the patient can go into a prerenal AKI when using the gliflozins. So then the next category of drugs is drugs because of its reduced clearance can increase the adverse effects. For example, metformin, when used in renal failure patients, can result in lactic acidosis when it accumulates. And sulfonylureas like gliclazide, glimepiride, glibenclamide, glyburide, or glipizide, when used in patients with illnesses, can result in hypoglycemic events. So there lies the importance of patients knowing these sick day medications. An easy mnemonic is SADMANS, where S stands for sulfonylureas, A stands for AC inhibitors, D stands for diuretics or direct renin inhibitors, M stands for metformin, A for angiotensin receptor blockers, N NSAIDs, and S for SGLT2 inhibitors. So basically, the diabetic patients need to know that when they are feeling unwell, when they are dehydrated, they need to stop these drugs for at least 2 to 3 days, and they need to keep a close watch on their blood pressures and blood sugars. And if any of these parameters are not well controlled, they need to talk with their physicians as early as possible. Hope you had a good session. Take care. Bye. Be safe and healthy.